The rheumatic fever is just an infection that mostly affect kids of age between the age of 5 to 15, but it's rarely to those ages below 3 years. And mostly it's caused by what we call beta hemolytic streptococcal infection that mostly affect the upper respiratory tract. So these are some of the signs and symptoms of these diseases are mostly you normally say that clinical signs. We normally get them during that time we are doing clinical examination and all those things. So most of them that, first of all, we have what we call carditis. It says that affect mostly the heart. We have arthritis, mostly affects the large bones, that is the joints, big joints. We have what we call chorea. Chorea mostly affect the brain. And we have what we call erythema marginatum, what affect mostly you find a bump on the skin. At least mostly it is pale and it has a red center. And also we have what we call nodules, that's subcutaneous nodules. Also you can get nodules that are painless on the body. Other symptoms include, you find the patient having elevated temperature of more than 101 Fahrenheit, which is let me say roughly 38 degrees Celsius and above. You find some having issues with the pallor. Pallor is just basically you find a patient having reduced blood. Yeah, and some might find patient coming irritable and all that. So those are some of the signs and symptoms of these diseases. Okay, mostly risk factors is when you have mostly find that patients having mostly upper respiratory tract infection and it's not treated on time. So most of these people, if they get upper respiratory tract infection, you find that having issues with that beta hemolytic, and then it affects the other parts of the body. So most of the time you find that we have we can do some tests like maybe laboratory tests. Mostly we do laboratory tests. We look at we do what we call a SWOT test, or we do what we call anti-streptolysin or titer, that is ASO. We look at them. Most of them they are elevated. Secondly, you find we have increased white blood cells, that we call it leukocytosis. And also you might find that some of them having issues with the reduced blood, that is anemia, that is what we call it. That's the reason why I said of pallor. Then most of the time you find we have most of complications. Complications mostly might affect from head to toe. We talk of in the head, we call that is chorea, mostly affecting the basal ganglia of the brain. So if you want to know the patient is having issues with the chorea, you find a patient having deterioration in handwriting. Mostly the kids, you find the kid was having a good handwriting, but with time you have that deterioration in handwriting. That also can suggest issues with the chorea. Now we have issues with the heart issues, and that is the only the complication that might arise having consequences in future if a patient have issues with the carditis. So mostly of this time, whenever you have antibodies that are affecting the heart, because the body develops antibodies against itself and start destroying its own cells. So if it affects the heart, you find now a patient might have issues with the valves. Have endocarditis, maybe issues with the swelling of the inner lining of the heart, we call it endocarditis. We have what we call pericarditis, the layers between the lining the heart, and we have also the myocarditis, that is the inflammation of the muscle of the heart. So also we have what we call some might have issues with the arthritis, but mostly you find that affecting these big joints. There are some of the complications that might arise with the issues with the rheumatic fever. Okay, ideally I've talked about the age. The age is between the age of 5 to 15. Most of them that are affected, most of those patients that are having that issue, you'll find that's between the age of 5 to 15. And then you'll find that we have 3 years. You might find also patients below 3 years having that issue, but they are rare. Yeah, those are, and mostly you find that girls are more affected than boys. Huh? If you do all those things, you find ladies are more affected than boys. Then secondly, we talk of treatment. Treatment, you'll find we have what we start with the primary treatment, where we are treating the cause, mostly the cause. Always we call it treatment step 1. We talk of treating the cause, or maybe the issues that the patient is having. So we treat with antibiotics. Mostly we use antibiotics. That's when a patient comes to the hospital, and we do all this what we call acid test and all that, antistreptolysin or titers. If they are elevated, we find that we're putting the patient on medication that is mostly called it Panada. They are going to get that medication for at least monthly until the patient reaches the age of 15 to 18. Then also we give a step 2 treatment. We say we are giving anti-inflammatories and also NSAIDs. So mostly we give aspirin for NSAID and prednisone, mostly that's the most drug that we normally use for treating, that is for the steroids. Then now we go to step 3, where we are talking of now we can give mostly we have what we call vaccines. We have the vaccines that children are being given during that birth. We have that schedule that we normally talk of. So the patients are given vaccines against the medication, against the disease and all that. Then the third, we are going to talk of, we are treating the complications. Maybe the patient might have issues with let me talk of issues with the heart. We are going to put the patients on antihypertensives and also those drugs that will help the patient to do what? To prevent further complications that may arise. Then after that, we are going to talk of the prevention. Prevention, most of the time we are talking of mostly we treat these upper respiratory tract infections. We treat them fully. We should not leave any stone unturned. At least when the patient comes to the hospital, we make sure that the patient is treated fully. So those are part of what we can do, part of the prevention. Also, we find that many patients, these children having these issues, we find most of them they are school-going children. So mostly when we go to school, we can do vaccination to the hospital, the schools and all that to kids. Also, we reduce overcrowding, we stop overcrowding, because we find most of the time this overcrowding, if we find one patient having, one kid having that, he might have also that another patient might have that issue. The third thing, cleanliness. We're talking of cleanliness. The hygiene, generally. Also, we have to improve the hygiene of the children, and that will reduce chances of the patient developing rheumatic fever. Yes, thank you.
Maybe umesema watoto wa kike ndio mostly wako affected na hii rheumatic fever. Okay, reason being mbona si wao ndio wako mostly affected?
Okay, normally talk of nature, we cannot change. Mostly we talk of gender. That's why we find some diseases. Some will say that men are more affected than women. So we normally say just gender, and also we are talking of the immunity. Sometimes boys will find that the immunity is high and all that. And also whenever you have that immunity, we find that sometimes whenever we have immunity that attacks, we find most of the ladies having that issue. But let me just talk of the gender. We cannot, something like that we cannot modify. We cannot explain much about that because it's something that is unmodifiable.
Okay.
Yeah.